today's House Call, we're joined by Dr. John Schorling from the UVA Mindfulness Center. We hear a lot about that these days. Let's start with exactly what is mindfulness?
Well, we define mindfulness as intentional present moment awareness. It's just about being aware of our experience as it's happening. And there are a couple of reasons why this is important. One is that we live our lives in the present moment, and if we're not paying attention, we're caught up in our thoughts, or we're doing something else, we're looking at our phone, we miss our lives as they're occurring. And the second reason is that a lot of the stress that we experience actually comes from thinking. We worry about something that's happened in the past, we worry about what might happen in the future, and we really wind up at the mercy of our thoughts. And mindfulness is about paying attention and noticing when we're getting caught up in thoughts or in worries, and just bring our attention back to what's going on right now.
We hear so much about living in the moment. Is there scientific research behind all of this?
Yes, there's now an amazing amount of scientific research. I just did a search last week and came up with over 3,000 articles in the scientific literature about mindfulness. We have evidence now that mindfulness is effective in terms of decreasing stress, decreasing anxiety, improving depression, improving quality of life, even decreasing burnout at work. And now neuroscientists have been studying what actually happens in the brain, and we now know that mindfulness and meditation not only impacts stress and anxiety, but it actually results in structural changes within the brain itself.
We've got about 20 seconds. How quickly can somebody actually see noticeable changes and results?
They can notice changes the first time they try an exercise. There's some people, the first time they meditate, they notice a substantial change. We always say more is better, and practicing every day is better than just practicing occasionally. But even one time, people notice a difference.
Dr. I appreciate it, your insight tonight. Thank you so much.
Thank you.
Sharon?